Standards. Let's talk about them. It's no surprise that in the physical therapy world, burnout continues to rise as our standards simultaneously decline. This means that the monotonous feeling that we have day in and day out transfers over to the way that we communicate and educate and coach our patients and movements. And going through the motions and doing the same thing day in and day out will burn out anyone. So that's why in this video, I want to share 3 simple strategies that you can implement today to raise your standards as a physical therapist. Strategy number 1, treat the patient, not the condition. It's far too common in the physical therapy world that we are treating conditions and not the individual. For example, let's say you have a low back pain patient that comes into your clinic. Often, we give that low back pain patient the same exact exercises that we gave the other low back pain patients. And for our shoulder patients, we give all of them the same exercises. Sure, there may be similarities, but at the end of the day, we need to make it more specific to the patient and their structure. So how do we do that? Well, during our assessment, we understand their asymmetries, we understand their breathing patterns, we understand their structure, which dictates their movement biases and movement patterns. This allows us to potentially have some carryover in those exercise selections, but make it and modify it in a way that is specific to that human being. This is how we stop guessing in the physical therapy world, and this is how we start producing long-term, life-changing results. Strategy number 2, provide educational value. Notice how I use the word value. I think a lot of us in the physical therapy world provide good education, but that education isn't valuable. For example, we often teach our patients about muscles, and we might tell them, hey, this is where X, Y, or Z muscle is, this is what it does, this is kind of where it inserts in the origin and all of that stuff. But what do they really do with that? How does that provide value to them? Instead, when we coach movement, when we talk about anatomy, we link it in a way that adds value to their pain point. For example, if we're teaching a posterior pelvic tilt, which is normally a pretty tricky exercise and movement for patients to learn, instead of telling Mr. or Mrs. Jones, I need you to posteriorly tilt your pelvis and you should feel your abs, and then I want you to raise a leg and I want you to do that 10 times. That has no value as to why it's important to them. Instead, link it to something they're familiar with and then link it back to their pain point. For example, Mr. or Mrs. Jones, I want you to learn how to move your pelvis. Your pelvis is here. It comprises of X, Y, and Z. Don't really worry about that. What I want you to recognize is that the back pain that you've had for the past 20 years is linked to the position and the inability to move this. So I want to teach you how to move it, and I want to teach you how to control it. Because at the end of the day, if you have a foundation that is faulty or cracked on a house, how do you think the first floor or the second floor is going to be? It's going to follow the foundation. Well, this is no different to that pelvis that I was talking about. So here's what I want you to do. Imagine you have a belt on, and that belt has a big belt buckle. I want you to tilt the belt buckle towards your feet. Now I want you to tilt the belt buckle towards your chin. Your pain is contributing because your pelvis is too turned, or your belt buckle is too turned towards your feet. I want you to learn how to get it towards the chin. Now that we understand that, now when we add these exercises in, think of it as restructuring that faulty foundation of a house, right? First floor, second floor, once you fix that foundation, those problems go away. As it relates to your back, when we start getting more familiar and aware and have more control and mobility and strength of your foundation, this pelvis that I'm talking about, that's when that low back pain goes away. This is why understanding this motion is really critical for your long-term success. So Do you see the difference? Isn't that a much better way than just telling them to do an exercise and teach them some of the muscles along the way? It has no value to them. They're not going to keep up with what they should be doing because they don't know the why. So strive to teach your patients the why by adding value to your educational components. Strategy number 3, provide exercise checklists. No, I'm not talking about going on to a generic exercise database with a picture, with some steps, and writing in, do 3 sets of 10. We're looking to raise our standards here, and we need to remove that and go to a place that provides more value. So the exercise checklist that I'm talking about helps the patient understand what they should focus on when they're doing the motion. It should help them understand the trajectory of the movement, and it should also help them understand what they should try to avoid when it comes to potential compensations. Let me give you an example. When it comes to teaching a lunge, I like to give patients a 3-part checklist. And those 3 parts are back foot, elevator, chicken. So let's start with the first one, back foot. A lot of times when patients go through a lunge, they focus on the front foot because that's what they see. Instead, I want them to shift their focus to the back foot, and I want their back foot to be super upright and vertical. What does this do? Well, first, this lets them now focus on the more important foot, the back foot. Because here's the thing. If they keep the back foot in the right position, the front foot really has no choice but to do the right thing. But the opposite can't be true. When it comes to the front foot, if we're just focusing on that and we neglect the back foot and have it in the wrong position, it creates the wrong movement. And that's where step 2 comes in. So we said we have a vertical heel. Step 2 was elevator. Now that our heel in the back is vertical, I want Mr. or Mrs. Jones to move like an elevator, not an escalator. So that's a very vertical up and down trajectory. But what does this do? Well, a lot of times when people move to escalator horizontally, this is when they normally have knee pain or back pain. So instead of getting into all of that, just tell them to move like an elevator, right? And so it tells them so much information, they might not even recognize it, but you know that if they follow the right trajectory, chances are their pain's gonna be pretty low. And then lastly, the chicken. The biggest compensation, Mr. or Mrs. Jones, is that when people stand during that lunge, they use their spine for momentum. So you know that back pain that you've had? We want to avoid that so that way we can get the legs stronger, but also learn how to do it correctly. So Mr. or Mrs. Jones, do you know how a chicken moves? This forward backwards motion? I don't want you to chicken it. When you come out of your lunge, I want you to stand using the legs and not move through your spine. So what did these 3 things do? They did exactly what we said. It helped them understand what to reference and focus as they go throughout their exercise. It helped them understand their trajectory, and it helped them avoid the biggest compensation that we normally see. If you can start to provide your patients with checklists like this for every single exercise, they will start getting results, they will start feeling better, and you will feel more fulfilled because you have raised your standards to a level that you've never had. And that fulfillment is ultimately what beats the burnout.